Good morning, everyone. Actually, it's noon here in Niagara Falls in Canada. Welcome to our 8th session in our WISER webinar series. Originally, we were planning to meet face-to-face in Berkeley, California in the USA on July 4th and 5th for our 8th International Indigenous Pre-Conference on HIV and AIDS, preceding AIDS 2020, which was scheduled to be delivered in both San Francisco and Oakland, in the Bay Area of California, USA. Both conferences, AIDS 2020 and our Indigenous Pre-Conference, were transformed into a virtual experience. We began on July 3rd and 5th with the 8th International Indigenous Pre-Conference for HIV and AIDS, and a two-day event leading into AIDS 2020, which is 5 days long. The WISER webinar series then continues through the month of July, from July 11th to July 30th. This webinar is being recorded and will be posted online in English, French, and Spanish. So about the Kudo webinar platform, the platform works on a request-to-speak basis. Presenters and audience members asking questions will have to request to speak, and then the moderator can grant them permission to enable their microphone and video. There's 3 tabs in the messages function: operators, participants, private. The operators tab can be seen by all participants and by the Kudo technicians. If you require any technical assistance, you can write to Michael, Eric, or Emma, and they can provide you with assistance. The participants tab can be seen by all participants and can be used for discussion with the audience. The private tab is where direct messages can be sent to any of the participants in the session. So you'll notice that on the right-hand side of your screen, if you have a computer, if you're on a tablet or a smartphone, it's on the left-hand side, you'll see polls. And there's 3 questions prepared by our evaluators that'll be made available at the beginning of every session. And those questions will be there throughout the duration of the whole thing. You can access it by clicking on the polls and then just typing in your answers. And the evaluation will help us to do better next time. The WISER webinar series and the 8th International Indigenous Pre-Conference on HIV/AIDS are brought to you by the International Indigenous HIV and AIDS Community, or IGWA in English, CHETIVS in Spanish. I'm the coordinator of IGWA, which is hosted by the Canadian Aboriginal AIDS Network, who act as IGWA's secretariat. Today's WISER webinar is titled Evidence-Based Responses for Diverse Indigenous Key Populations. The session opens with the film Hilo Rojo, a documentary from the National Network of Native Peoples, Renpo, about the emergence of HIV in Chile's indigenous population. 2 of the film's creators are here with us to provide insights into the making of the video and to answer any questions you might have. That's Patricio Quesada and Matias Soriano from Chile. After the film, we'll be treated to a presentation about Indigenous masculinity, HIV wellness, and disclosure. Aaron Lee from Canada will explore how Indigenous masculinity can be a protective force for Indigenous men as they address the barriers and challenges of living with HIV. The third and final presentation is titled Exploring the Health Experiences of Indigenous Trans, Two-Spirit, and Gender Diverse Communities, a Scoping Review. Carol Lopez and Randy Jackson from Canada will discuss the range of existing research on the health experiences with health services of Indigenous, gender diverse, trans, and two-spirit people, looking at 4 major themes. So without further ado, I think I've spoken enough. I'd like to introduce you to Patricio Quesada and Matias Soriano from Chile. And thank you very much to you both for adding in the English subtitles into the video. You see, because we were going to meet in person for the pre-conference, which requires a great amount of funding for travel and accommodations for everyone, we didn't know if we'd be able to offer interpretation. So we asked for subtitles to be added in English. And thank you very much, Patricio and Matias. But now here we are, doing this online with English, Spanish, and French language interpretation. Thank you to our team of interpreters. You've been doing a great, excellent job, actually, throughout all of our WISER webinar series. So would you like to say a few words to quickly introduce the film before we roll, or are we good? Patricio, Matias?
Yes, Hilo Rojo es un documental que...
Red Thread is a documentary that we created together with Renpo, National Network of Native People. And we talk about how to educate our partners, our families about HIV in the indigenous communities. Also, they are carrying out talks with the government ministers, health ministers in Chile, in order to have measures that we can apply to respond to this pandemic. So this is what we try to show in this documentary film. I would like to add something. This is a film that tries to look for empathy with the indigenous peoples. We want to see them included in the creation of public policies and to make sure that they have access to information, because this is key to respond to the pandemic.
Thank you both, and let's roll it. Let's watch this really interesting film. In the upper right-hand corner, you can choose your viewing, how you view, so that it'll be full screen.
Mari Tupeñi, Mari Pulamien, Inche Willy Morales Piñén, Inche Kuchan VIH SIDA, Inche Modgen, Futawapi Chilwe, Castro Guarrameu. Mi nombre es Willy Morales, soy una persona que vive con VIH, vivo en la isla de Chiloé, en la ciudad de Castro. En los años primeros de la pandemia en Chile, de la pandemia del SIDA, yo fui notificado siendo menor de edad. Y, o sea, te puedo contar la historia viva del SIDA en Chile. Y estaba como entre Frey y Lago, estaba ahí como el traspaso de gobierno, y ya la pandemia aquí era pandemia, pues la gente se estaba muriendo Ya no eran un grupo de personas con una enfermedad rara. Habían hombres, mujeres, niños, indígenas, el cual necesitaban la medicamentación que en el mundo existía y en Chile no existía. Quienes tenían opción más primera a esas terapias eran mujeres con hijos. Después venían los padres de familia con hijos. Después venían mujeres solas, hombres solos, y los últimos eran travestis e indígenas. Y fuimos y nos encadenamos en la Corte Suprema exigiendo el derecho a vivir. La policía tiritaba que cómo va a tocar a los idosos. Y la policía se puso guantes plásticos, estos guantes de látex, para podernos tocar. Y nos arrastraron. Nos arrastraron a la primera comisaría y ahí estaban todos tiritando, ni siquiera nos preguntaron cómo nos llamaban, a un calabozo inmediato, porque estaba ese miedo del contagio, de la transmisión, que no se sabía de qué manera, si tenía SIDA era muerte.
Munata tatainti, achachilanaka, tapaca colio, illimani colio. Munata pachamama, munata tatainti, munata achachilanaka. Nos autoconvocamos para solicitar permiso a nuestros dioses que nos acompañen en esta actividad, donde pondremos nuestros mejores deseos y sentido comunitario.
Mi nombre es Catalina Cortés, soy del pueblo aymara.
Yo me llamo Isabel Pacarati Tepano, pertenezco a la Renpo Rapa Nui. Es una red a nivel nacional e internacional para comunicar sobre la prevención de riesgos del VIH.
Para mi comunidad es un tema lejano, es un tema que no se ha tocado, que no ha llegado. Yo vivo en territorio aymara y poco se habla. La política pública ha sido muy escasa para llegar a las comunidades aymara.
Isla de Pascua es a nivel nacional e internacional, es uno de los puntos que llega turismo de diferentes partes del mundo. Viene de diferentes partes a la isla. Especialmente la que más me preocupa es el tiempo de la fiesta de la Tapati y Rapa Nui, que es una fiesta de nosotros.
Ni siquiera las escuelas, en las estaciones médicos rurales no llegan, hacen acciones de salud en otras líneas, pero de VIH no he visto en mi comunidad.
Se prometieron capacitación de pares en las regiones. Se prometió también un acceso a los tratamientos para aquellos pueblos que están en zonas alejadas. No se ha cumplido nada de eso. O sea, hasta ahora lo que siempre yo he reclamado, ya, y les he dicho, esto no es un resfrío, ya, que yo lo pueda con una aspirina. A nosotros si se nos muere un indígena, se nos muere parte del pueblo, ya, y eso no puede seguir ocurriendo. No nos puede seguir pasando de que nosotros pidamos ayuda al Estado, que por derecho nos corresponde en este sentido, de tener acceso a una salud digna, de que nosotros somos pueblos prioritarios, estamos prioritarios en relación a los demás, y sobre todo con este tipo de pandemia. Pero sin embargo, hasta ahora no ha ocurrido, ¿ya? Y queremos que esta instancia, para que ustedes se comprometan, para no tener que empezar nuevamente con el gobierno de turno, de cero. No podemos seguir en eso, porque cada vez se nos está muriendo más. Lo dijo muy bien el hermano. Esto no es un chileno cualquiera. Este es un pueblo indígena que tiene su idiosincrasia, que tiene su cultura, que tiene su cosmovisión, que no es la misma de los demás. Los demás, si yo voy al médico, me recetan los remedios, listo. Pero aquí no. Aquí tiene que confluir todo. Tiene que confluir el día, la familia, la persona, el tipo de enfermedad. Entonces, si no nos hacemos uno con nuestras tradiciones, con nuestra medicina, más la medicina que se da en los hospitales, no vamos a conseguir nada. No pueden ser considerados al igual que un club de fútbol, que una junta de vecinos. Es diferente. Es por ello que las políticas tienen que ser especiales, tienen que ser con pertinencia indígena. Hay que hacer una campaña de prevención, pero de prevención enfocada a las diferentes áreas de tu pueblo indígena. Yo no puedo tomar el pueblo indígena de Punta Arenas al igual que el de Arica. Son realidades diferentes, son realidades diversas, son un modo de ver la vida diverso.
Mari Lamien, Inche Ruta Antipichón Piñén, la Guantuchefe del Centro de Salud Mapuche Mirilagüen la Guantuchefe. Nací y soy criada en Curarrego, la 9ª región, de Hualmapu de la Araucanía. Bueno, yo inmediatamente, ahí cuando alguien llega acá y me informa que tiene el VIH, yo inmediatamente busco a la matrona. Ahí nosotras dos con la matrona conversamos y entonces yo le doy el lagüen que nosotros le damos, que es el pangue, y también nosotros le damos el pangue con la uña de gato, también con la sangre de grado, porque eso también ayuda a todas las enfermedades por dentro, a curarla y todo, y saca todas las heridas que tiene, y esa o sea, es como el matico que yo le pueda dar a él porque le sane por dentro. Pero eso va acompañado de esto de la medicina que nosotros le vamos a dar al usuario que viene con el VIH. Y ahí le damos un tratamiento para que él pueda seguir diariamente cada 15 días, que tiene que venir y darle su lagüen correspondiente por 6 meses, por su atención, pero de control son 12 meses, para poder darle un diagnóstico si acaso él ha bajado o ha subido su gravedad de la enfermedad.
Inche llena de Santiago y el Lorca Piñén, Lampa Guarremeo, en Chequeyo del Centro de Salud Mapuche Mirilagüen la Huentuchef. Y la hierba, como sabemos, nosotros no viene quizá a reparar lo que la medicina todavía no logra, que es sanar el SIDA, pero sí también, como es la triterapia, puede lograr también apalear un poco los síntomas y mejorar el sistema inmune de las personas.
Ahora, el hecho que se esté tratando de integrar la medicina indígena, la medicina ancestral, va a dar muy buenos resultados. ¿Por qué? Porque son ellos las personas en las que tienen confianza. Yo como pueblo tengo confianza en mi yatiri, como pueblo tengo confianza en mi machi.
Bueno, en lo personal yo pedí mi placenta, hice la ceremonia, tuve mis hijos con parteros y es algo importante, o sea, la valorización de nuestros parteros y el conocimiento, tener gente en nuestras comunidades que con solo tocar a una embarazada saben la fecha del nacimiento, saben el sexo de la guagua, es algo importante.
Bueno, para nosotros los chachai es una parte fundamental para nosotros porque tienen la sabiduría y el conocimiento. Ellos tienen todo el raquiduán, tienen todo el... para nosotros ellos son muy sagrados, ¿ya? Ellos tienen el kimun. Entonces, para nosotros ellos son la base principal, que es nuestros ancianos, los que nosotros somos los que respetamos y los que cuando necesitamos un consejo llegamos a ellos. Entonces, obviamente que es fundamental que estar siempre nosotros llevándole la enseñanza también a ellos, y por eso es necesario capacitarlos también a ellos, para que ellos puedan enseñar a sus nietos, a sus bisnietos, también para que, porque nadie está libre, o sea, en cualquier momento nadie sabe lo que pueda pasar. Entonces, por eso es necesario también a ellos tenerlos informados de toda esta pandemia del VIH.
Nosotros aquí los chilotes, el mar es nuestra fuente de vida. Para mí, es tan importante, eso es esto, y agradecer también a nuestros ancestros, yonos y huilliches, navegantes de esta tierra, en que dejaron este pedazo de mundo, este pedazo de historia aquí en este pedazo de tierra para nosotros, que todavía somos muy felices y no ha pasado nada. A ellos yo les agradezco de todo corazón, a nuestros ancestros, como te digo, que están presentes, deben estar presentes como estrellas en el cielo, vigilantes, y por eso también nosotros le hemos enseñado a nuestros hijos, a nuestros nietos, el cuidado, el agradecimiento al mar, una fuente de vida que dejaron para nosotros. Bueno, aquí en Chiloé los partos fueron, yo creo que en todas partes del campo, donde la gente está alejada de las grandes ciudades, y los partos eran distintos.
So giving birth was different. There was a woman, it was usually a midwife, who was in charge of taking care of women. When they were pregnant and they were going to give birth, they came to help them. I think this has been lost throughout time, and it is very important for us. We should always rely on those women because they were wise, they knew about that subject, and they should be there. Of course, now they must be very old, but maybe we can rescue their knowledge and their teachings. So I can tell you about my father. My father was the one assisting my mother when we were being born. For most of my siblings, that's what he did. We were living in Quillon at that time, and the chances of going to a hospital were impossible. But that is a very nice memory for me, to having my father there from the first moment when I was born. He would help us, he would get us dressed, and then give us to my mom. And then he would bring the placenta outside, and he would dig a hole under the fire and put it there. Or maybe he would plant a flower or a tree on the placenta so that the placenta would become part of the life. This is our right. Even if we have HIV, it is our right to have our placenta, because we know that it has to go back to the earth, to the soil. No one is free, but it is our right. And if you do things right, you should be able to have your placenta. It's my right. My name is Yana Alarcon. I am an infectious disease doctor, and I am part of the group Chile AIDS. It is a group that puts together all the people that work with AIDS in Chile. We have to talk about treatment and diagnosis because there is a gap in this field. It is important to see things from the worldview and the position of Indigenous peoples. They are vulnerable, we know that. They have a scope of the reality that is different from Western reality. The WHO has already stated that there are cultural and traditional issues that we have to think about when we think about HIV. If we have a reduced scope on the Western view, it is going to be very, very hard to reach people. Why? Because this means that they have to change their costumes, they have to change their ways of living. It is important to reach farther, to be able to fill this gap. And we have to help everyone, regardless of their ethnicity, their culture. It is important to take into account their cultures, their knowledge. And you have to learn how to educate people from their world vision. It is the only way. If the state decides not to recognize indigenous medicines, we're not going to have a treatment that it's a plan B. We're not going to have that because we're not being taken into account. And Chile is signing those agreements recognizing indigenous peoples. And for that, we need to recognize their traditions, their medicine. We need to recognize Aymara and Yakiri and Machis. They can help us for achieving adherence to the medicine. But what is the government doing? They're saying there's no research about this. We are not outside this situation. We are being affected by it more often than not. Indigenous peoples do not trust the public system. What do? We go to hospital on the last minute and we die. The authorities, the public services are not doing their work. They do not go to each one of the regions. They don't go and meet the people. They don't go and see what is their vision. The more participation we have, then we're going to have more control, more support, and we are going to be able to face this epidemic in the world. The more we include Indigenous peoples, we're going to be more successful. The treatment, prevention, diagnosis, and research are going to succeed. The relationship that there is between Indigenous peoples, in this case Renpo, and the Chilean government is necessary. It is important. We have to have a public policy that reflects this. We, as Indigenous peoples, we have different topics that we need to address. But HIV has to be part of this. It has to be part of the roundtables, of the debates, of all of the activities. We have to have this very present. HIV is as any other disease. We have to help our siblings so that they can be part of the society. They cannot feel ostracized. They cannot feel isolated. People sometimes think that this disease is going to kill them, but it's not the case. People think if you have HIV, you're going to die. But as a person who has been diagnosed HIV positive, you know how to take care of others so that they're not affected by it. That is the main point. We need to educate people. We need to have access to health centers, and they have to help people who are at risk. Before, it was Spanish. Now is HIV. At least the Spaniard was there. You could see it. You could run away. So what do we do now? We need to learn. We need to inform ourselves. We need to know, what is it? How is it dangerous? Can you cure it? Those things are information that the state didn't share with us. So now we need to educate people for the well-being of Indigenous peoples. Chala, for example, the Chala people, they're very few. If one of them dies, then that's extinction. Same for the Kawesla people. They're very few. If one dies, that means extinction. What is ILO saying about this? Public health should be a priority for Indigenous peoples. And the states need to respect this. And my question is, do they?
No querer despegar, entrar en razón, no todo llegará a su debido tiempo ya. No todo es atemporal, a su debido tiempo ya. No todo es atemporal.
Wow, that was quite interesting. if you do have questions, if you're in the audience, you can use the chat function there and type your question into the chat box, or you can click on request to speak, and the technicians or I will allow you access to your microphone and in the camera. But Patricio and Matias, you know, when you sent in the idea and you told me about this film, I was like, okay, so what is this Hilo Rojo? What does it mean? So I went to Google Translator and it tells me it means red thread. And I was trying to think, maybe they meant red ribbon, the AIDS ribbon. I don't know. I was trying to figure it out for weeks until you submitted the video and I watched it, and I think I figured it out. And I'm wondering if anybody else in the audience, what is the red thread? What significance does it have to Indigenous HIV? What do you think, Matias? Or Patricio? Do you think people understand? Or maybe I don't understand too. Anybody in the audience want to give it a shot? What is the red thread? Yeah, go ahead, Patricio.
Okay. Hilo Rojo.
Red thread. The red thread, the concept of red thread came to be for the connection that it has with the red ribbon. The red ribbon is the symbol of the fight against HIV. It starts there, but it goes to the indigenous communities. Red as a color is present in different things in their lives. So we realized something. We thought that the indigenous peoples that we met during our filming process, they were selling some handcrafts, and they also sold thread and wool. And when we were there, we met Willie. We went to his store, and he had a lot of red wool. So we thought, okay, that should be it. It clicked. That red ribbon is present in the indigenous culture, and it is a way that helps them support their lives. Also, red represents blood. And HIV for indigenous peoples in Chile is a disease that you get in your blood, right? But the thread is also a metaphor with the placenta. And that is one of the topics that we addressed in the film. In our country, there was a long process for public hospitals to allow indigenous women to receive their placentas after giving birth for the rituals. And that goes beyond the Western worldview. It is different from the indigenous worldview. So at the end, red thread is this constellation of concepts. How did we unify something global as HIV and AIDS with the indigenous culture? So red thread is the unifying process.
In my culture, in my mother's culture, in the Ojibwe culture, we also bury the umbilical cord and the placenta in a sacred place, you know, in our communities. And it really strongly represents that we are connected to our Mother Earth. And we will always be connected to that part of the earth. And that is where my home fire is. And I'm very impressed that the film explains it so well. And, you know, when the one lady's talking about, we're not a football club. You can't treat us like a group of people, like a football club or like some school, or indigenous people have a particular worldview in it. And anything that, any intervention or some kind of response to HIV or any other issue in the community needs to use the cultural framework, or it's not going to work, right? Is that what you're saying? That's the kind of messaging I'm getting from the film.
Matías.
Sí, nosotros opinamos lo mismo. Creemos que
Yes, we think the same. Indigenous peoples here in Chile, for example, they have a strong connection with the placenta. It is part of the process of having a child. So we believe that that was one of the reasons why we included this in our film. May I speak? Or are you getting the translation? Oh, I would like to add something. Regarding your question, Trevor, what we try to portray in the film is a conflict. The conflict is that in Chile, the indigenous peoples are located in different regions. In Arica, for example, we have the Aymaras, and the Yagaras are in the south. So in Chile, we have 9 indigenous communities. Each one of them has their own world vision. They have their own connection with nature. So, for example, the campaigns that they have for HIV prevention, it is a struggle. It is a struggle with Renpo, because Renpo tries to have more inclusion. But in order to have more inclusion, they have to also include the different cultures in their campaigns. We see that the power is focused in the city. And most of the people who are indigenous peoples, they live in rural areas. And they have a different perspective on life. And sometimes these are not being taken into account. So, for example, when there is an HIV campaign and they try to reach indigenous communities, they try to include someone who is dressed as an indigenous person, but it's one culture, it's representative of one culture. So they are really not understanding the depth that is required for the messages and the inclusion of the people. We cannot exclude anyone who has HIV, but we need to work together. They are part of the struggle. And this has to be part of the message. We need to think about how to unify, but we also have to respect each community. And we have to learn about each culture, because if you do not have specific messages for specific communities, then maybe we will still have people who do not believe that this disease is real. So we have a long way to go. And the government in Chile should go and learn about everyone's reality, not only about HIV, but other topics as well. We need to educate people. And like that, we will be able to comply with the objectives, the health objectives. These objectives are global for Chile and the rest of the world. So I think that this is part of the debate, because sometimes they feel that they are just a soccer team, because each group has their own community, their own group, but they're not unified. So I think that this is a little bit of what is missing in Chile. We need to connect people. We need to connect people from the cities to the rural areas where indigenous peoples are. to be honest, at least from what we see here in the Mapuche or Wikiche vision, these are the peoples who live in the south, they are trying to be recognized as a community. For example, when we went there to film the documentary, we met Sonia Guatepilan. She is Wiche. She lives in the Chiloé island in Chile. And she talked about the Epupillan term. What is this? It means having two souls. And I think that this is what you were referring to, Trevor. It is like having two souls. So she never said anything negative about this, for example. She just mentioned how this is seen, how is this perceived, and they have a term for it, which is epopeia. Also, I would like to include something. I have a book here, and I would like to recommend it because it talks about the world vision of the indigenous peoples. It is named Two Spirits and the Divergence, and I think it addresses a little bit of the topics that Amaranta was bringing up. Okay, so this film came to be after a university project. We were able to use the equipment that was provided by the university. But first we spoke to Willy Morales. He is the president of Renpo. And he was our gateway to see these realities. Now, financing. Well, the two of us carried out a lot of that weight. And also Patricio helped with it. He was able to provide the equipment, and he was also able to get us to rural areas where we were doing the documentary. I would also like to thank Gresna Alarcon because of her or his participation in the film.
Cultures, talking about the similarities and how they have a similar practice, honoring the placenta and using the umbilical cord as the connection to Mother Earth. So I thank you, Director Matias Soriano and Executive Producer Patricio Quesada, for your most excellent film, Hilo Rojo. Thank you so much, and I appreciate that. And we'll move right along now to our next presentation. So don't forget that there are polls on the right-hand side of your screen if you have a computer. It's on the left-hand side if you are using your phone or a tablet. Just have a look at the 3 questions and give us some good feedback or bad feedback so we can make it better next year. This is the first time we're doing this, and we really appreciate your patience and your understanding as we do something we've never done before. So maybe we should have been doing this all along, and the lockdown has just forced us to do some of the things that we've been putting off for a long time. You know, one of the extra benefits that we didn't realize was going to happen is that we are now able to record these and put them online with interpretation in English, French, and Spanish, which is something new for us. So our second presentation is called Indigenous Masculinity, HIV Wellness, and Disclosure. This presentation will share and discuss how Indigenous masculinity can be a protective force for Indigenous men as they address the barriers and challenges of living with HIV. Research opportunities to examine how to integrate considerations of Indigenous masculinity in services will be explored in the near future. So I'd like to introduce you to Aaron Lee from McMaster University. Welcome, Aaron.
Thank you, Trevor, and thank you for the wonderful introduction. Yeah, my project is called Indigenous Masculinity, HIV Wellness and Disclosure, and this was the thesis project that I completed to complete my Master's of Social Work from McMaster University. So just to begin with a quick introduction, a little bit about myself. I was born and raised in Toronto. I completed my bachelor's degree in social work and sociology from McMaster University. I completed my master's of social work degree also from McMaster just a few months ago, actually, earlier this year in January. And to talk about because it's not, I personally haven't met very many other Asians who are purely dedicated, interested in working with Indigenous communities. So what I found was that there was a constant challenge to try and socially locate myself within the research that I work with. To do an Indigenous-based, Indigenous-led research project there's always a lot of ethical tensions that I had to reconcile. So to situate myself in the research, what I found was that my pathway towards a researcher and towards becoming an Indigenous ally had simple beginnings, but it was a very complex process. While I was in undergrad and while I was younger, like 19, 18, we're constantly trying to develop and understand myself. My goal in social work has always been very simple, to try and create the greatest impact using the short amount of time as possible. Because I felt that, the world, there needed to be bigger change in the world. And so working with individuals was not something that I was particularly interested in. I want to see how far I can go and how far I can work with communities to affect systemic change. So when I took a few Indigenous courses back in undergrad, the message was very constant, very consistent. If you had the knowledge, you should try and do something about it. So that's what I did. With that one line and with my personal mission, I just rolled with it. To constantly try and use the knowledge that has been given to me to become a benefit to the world around me, to the Indigenous communities around me. So this process was fairly challenging because it required me to immerse myself in decolonizing methodologies, Indigenous methodologies. So, I am a first-generation Chinese immigrant, but I was raised in very many community-centric values that was given to me by my mother. So, many of the values, although they're not the same, but the decolonizing approaches and the Indigenous methodologies resonated with me on a very personal level. And it instilled in me a very deep desire to bridge these values as part of the research that I use and how I connect with those that I interviewed and those that I worked with. And so here we are now, finished my MSW, still working at McMaster and looking towards a PhD in the future. And I just found that I'm just learning as I continue to follow my path. There isn't a lot of information, there isn't a lot of standardized guidance out there for an Asian guy trying to do his best to work with the native population in Canada. But maybe that's the way that it was meant to be this whole time, So I knew that this would be a unique path that I would only be able to learn as I continue walking down it. So I tried to focus my strength towards knowledge acquisition and developing research and coordinating skills and building my relationship with Canadian and now international Indigenous scholars, knowledge keepers, and allies. And so this thesis project is a culmination of all these experiences over the past 5 years, maybe 6 years. I lost track. I don't really keep track of these things. as I continue partnering with Indigenous communities in the future. So now to provide a little bit of background information about my project. So we can really see two stories of how Indigenous peoples living in Canada are portrayed. Indigenous peoples living with HIV are portrayed. There's a story of statistics and a story of narratives. So beginning with some statistics, 12% of newly diagnosed HIV infections and 8% of those living with HIV in Canada are represented by those with Indigenous people. Now, of the 6,300 HIV positive Indigenous peoples diagnosed at the end of 2011, slightly more than half of them occurred amongst Indigenous men. And through HIV epidemiology data, we can also measure the independent causes that contribute to those overwhelming representations. Right. And these independent causes include later diagnosis, reduced healthcare engagement, delays in therapy, and general access to healthcare. Now, that is the story of statistics, but what is missing in these numbers? The numbers can only reach a certain point, and they're unable to capture the full realities of the experience of Indigenous peoples. You miss the skills, the strengths, and the resiliency that Indigenous peoples mobilize towards actively seeking to become a beacon of light for those around them and to themselves, to their family, to their community. And so when we step away from the pathological examination of Indigenous peoples, what we begin to see and explore is how culture and gender can become a protective force in promoting resilient responses to the challenges of HIV. And specifically for this project, what I'm looking at is how an Indigenous masculine identity intersects with experience of HIV, and how the processes of disclosure can really help with protecting and preventing some of the challenges that come with HIV stigmatization, healthcare challenges, etc. Right, so the goals and specific objectives of my thesis project was to examine how masculine identity is impacted by colonization in the context of HIV and HIV disclosure for Indigenous men. And the specific objectives under this goal include the following. What are Indigenous men's ideas about Indigenous masculinity? So to come up with a definition and to understand, what is Indigenous masculinity to begin with? How do Indigenous men understand the impact of colonization on their masculine identity? And lastly, how do Indigenous men experience HIV disclosure? Now, where did this idea come from? This thesis project was developed through dialogue with Professor Randy Jackson at McMaster University, who was also my supervisor, and the next presentation after mine. You're going to hear from him, I think. I was always talking to Randy, who was more than just a supervisor, but also a mentor throughout my undergrad degree, because there are great challenges that I went through understanding, what does it mean to be a man in social work? How do we present ourselves as male social workers? And is there a way, is there a correct way to go about doing things? So with that dialogue, we moved towards talking about a project about Indigenous masculinity and HIVs. And that project examined the ways HIV positive men, Indigenous men come to learn and practice a positive masculine identity as they respond to the challenges of living with chronic illness. And so this idea was articulated to Randy as the men described the need to better understand how colonial processes shape health risks, and how Indigenous men come to a lived understanding of their traditional gender identities as a vital source of strength. So my project adopts a similar orientation in exploring the harmful effects of colonization, but takes a more focused and closer inspection on the processes of disclosure and self-presentation on masculine identity. Right. So before doing the interviews and gathering the data for my own project, we first have to go through a quick literature search to see what's out there. How do other scholars currently explore the topic of indigenous masculinity, HIV, and HIV disclosure. So the purpose of this literature review was to determine the specific themes surrounding the research topic and to use those themes as a point of reference to later analyze the data. Now, my search strategy was very specific. I used a few different databases, and I used keywords that were to generate a search formula to capture my research topic, right? It had to include a focus on indigenous masculinity, HIV wellness, indigenous masculinity, HIV wellness, and disclosure. And so here are the findings from my literature search. First, there was a limited theoretical framing of indigenous masculinity in the context of HIV. But while indigenous men have been extensively studied within academic literature, masculinity and HIV has often been described in relation to sexual activity and sexual identity. There was marginal consideration, however, of how masculinity intersects itself with indigenous men's everyday lives and everyday experiences. So based on this theme, the framing of indigenous masculinity, it is suggested that additional research is needed to better understand how indigenous masculinity in relation to gender roles and expectations, identity formation, community work needs to be further explored. The next theme that I came across was the pathologization of indigenous identities. And specifically, I was talking about, referencing the identity of two-spirited men. From this literature review, two-spirited men are often written, two-spirited men were written in association with health deficiencies, higher rates of victimization, substance use, HIV risk behaviors, and unhealthy sexual practices. But as an indigenous term, two-spirit extends beyond sexuality, but it is more of a culmination of gender, community, culture, and spirituality to create an identity. But the impact of these health disparities and associated risk behaviors takes away focus from the traditional intrinsic value and reduces it to a set of victim-based values and classifications. And the framing of indigenous identities within this singular positioning just focuses purely on vulnerability and victimization, and just contributes to the pathological view of two-spirited identities and individuals. And so the literature shows that processes of colonization might have manifested itself within indigenous gender and sexual ideologies, promoting dominant Western discourses surrounding what it means to be heterosexual and what it means to be a normal man. So the construction of appropriate or normative gender behavior, which supports the idea of normative masculinity, can often create conflict with how indigenous peoples come to experience masculinity, especially when indigenous identity come into conflict with Western notions of masculinity. So while their sense of identity can be rooted in indigeneity and cultural teachings, the ways in which colonial ideologies mask themselves as normative assumptions of masculinity and male presentation presents itself as an area of concern, especially when there is a misalignment between identity and male identity. So what does this mean? It means we need to go deeper and dive into how indigenous masculinity pushes back against these type of normative, hegemonic gender identity, and how it can become a more self-protective force and promote self-protective behaviors rather than create internal discrepancies. And so the last two set of themes from the literature we found was the stigmatization, and was that there was a prevalence of homophobia and stigmatization for gay indigenous men within their traditional communities. So according to the literature, homophobic messages are coupled with messages of victimization to create a very unique experience where HIV positive gay indigenous men come to experience barriers in reconciling both their traditional identity and their sexual or gender identity. With these factors in place, home or traditional communities become an unsafe place to disclose their sexual identity and their health identity. So rather being able to foster open dialogue between the men and their local support systems, the prevalence of homophobia and stigmatization creates a difficult atmosphere for them to practice their true, authentic indigenous masculinity in alignment with the entirety of all their identities. So what are the implications of some of this, of not being able to reconcile these identities? Some men found that they need to seek opportunities for this type of gender and or sexual disclosure outside their families in fear of homophobic backlash, and move towards urban areas which may be more accepting. But what they find in these settings is that they experience racism or racialization, which limits their opportunity to further practice their indigenous identity. So this is very troubling from the literature, because there's not very many spaces in the community for them to practice their gender or sexual identity, and opportunities to practice those in urban settings limits their opportunity to practice their traditional settings, traditional identities. So with that in mind, and we're going to revisit this later in the implication section, or the directions for future research. How can we find a space for these indigenous men to not only be able to express their true authentic self, but what does it mean to express their true authentic self and their masculine identity in association? So those are the lessons that we found from the literature review. There's very little information that can be found on indigenous masculinity in the context of HIV and HIV disclosure. And so disclosure, like indigenous masculinity, was also often framed in relation to sexual identity and sexual activity. While that is important, my project specifically will focus more on how disclosure comes in the form of HIV disclosure, and how the information is received by the audience, and how different spaces disclosure has occurred. Next, there is a little emphasis on the everyday processes where men experience healthy expression of health. And this is a result of the constant, as a result of racialization, homophobia, stigmatization, and other type of forces that come into conflict. And so part of the discussion for my project will be around how indigenous masculinity will be around indigenous masculinity and the considerations indigenous men take to choose to live a healthier lifestyle, and how indigenous masculinity contributes to this decision. And lastly, one of the things that I really want to focus on for this project was that I really want to adopt a strength-based approach. Right. So much of the research that I found in my literature research took this pathological approach towards framing the experience of indigenous men. So rather than focus on the deficiencies, I want to build upon a strength-based approach that incorporates the inherent strength and resilience found amongst indigenous men to serve as this foundation for indigenous masculinity. So with that in mind, the background information set, we move towards the methodology for my project. So beginning the process before reaching the stages of data collection, and this ties into the very complex experience I had in socially locating myself in my research. Careful consideration must be made to determine the most appropriate methodology and methods that were used within the research population. And this is to establish a methodological framework that is most suitable to draw the experiences and to accurately draw the experience of indigenous people that allow them to control the narrative rather than pathologize their experiences. And so I found, as complex as this process was, I somehow managed to find myself on a linear path towards developing a methodological process. It was a 3.5-step process that kind of led into each other that could really be followed systematically. So first, I had to go through a process of decolonizing research. So especially as a non-Indigenous researcher working with Indigenous communities, there was an obligation for me to develop my research capacity to become more knowledgeable and immersed within Indigenous paradigm. So as part of decolonization, this process required a twofold, learning and unlearning what it means to do research. So before conducting the research, I had to educate myself on the history, the cultural, the social realities, and traditional values of Indigenous communities. And little did I know when I took the courses that my path towards developing this methodological process began in undergrad when I was taking these courses and educating myself of these traditions, the history, and the culture of Indigenous peoples. And then the further unlearning of what it means to do research was then completed, or it was being further developed when I was talking to my research supervisor, completing my master's courses, and dismantling what it means to do research with Indigenous peoples. So this learning and unlearning is not something. While I describe things as linear, this learning and unlearning is a constant process of challenging myself to know what, is this the most ethical process to go about things? Did I miss anything along the way? Is there further consideration of an area that I need to make? So the shift towards decolonizing research is not always to dismantle everything that I know about research practices, but to illustrate that alternative methodologies and integration of Indigenous ways of knowing can be used to better represent and capture the narratives of Indigenous communities within research. But decolonizing research, more than anything else, is a process that that creates spaces for Indigenous peoples to return to their own life perspectives and culturally articulated goals without the imposition of Western concepts and paradigms. And so I really pursued authentic outcomes and findings that would be in line with traditional knowledge and Indigenous communities that can limit the effects of colonization and the misrepresentation of Indigenous peoples. So for this research thesis project, as I mentioned before, decolonizing research involved decolonizing the South, understanding Indigenous epistemologies and perspectives towards culture, and understanding how to use how these things will weave itself into the methods. The objective was to maximize opportunities to use language that was closest to the participants, allowing them to define everything that was most accurate for themselves. So after that process of learning and unlearning, as that process is going on, I turn my eyes towards integrating Indigenous ways of being and knowing. So while it is impossible to adopt the same principles and values across every single research project, or to use the same principles in a constant basis, given that there are multiple cultures in Canada, Indigenous cultures in Canada, and there are differences in values, differences in worldviews and culture. There is articles that I've read, there are certain consistent relational approaches that is fundamental to working with Indigenous peoples. And this relational approach situates the researcher in an accountable relationship with the world around him, or with the community around him, where the knowledge is to be shared and returned back to the community. So as part of this commitment, the knowledge becomes relational, as the researcher is expected to understand that the knowledge they acquire will eventually be used back to benefit the communities around them. And so following a research paradigm that was laid out by Hart, I followed three aspects of Indigenous ways of knowing to guide my research. The first being understanding that knowledge is subjective and unique to the individual. As individuals engage in the journey through life, the subjective experiences they acquire throughout that process is considered a form of experiential knowledge. The second is an interconnectedness between the individual and the world around them, where knowledge is passed down to future generations through storytelling and teachings. And the third aspect to be discussed is the relational perspective of knowledge, where knowledge and experience touch on internal balance between the balance of the spirit, the mind, the body, and the context. The spirit includes teachings, teachings, dreams, stories, forces, and gifts. Context refers to the social context where the individual is situated. The connection with the environment and the connection to land. The mind encompasses knowledge, emotion, and experience, and memory. And body refers to nutrition, sleep, rest, age, and substance use. And so all of these factors, I did my best to design my research questions to encapsulate all of these, and all my questions to draw as many of these experiences as I can. So with indigenous ways of knowing and being in the background or laid out, and now focus towards using an indigenous methodology. So the appropriate use of indigenous methodology is to incorporate, as I mentioned before, the ontology, epistemology, methodology, and ethics that is in line with indigenous ways of knowing. So once presented with the knowledge and history of indigenous people, in accordance with indigenous methodology, there's an expected internal sense of commitment to use that knowledge on the benefit for indigenous peoples. So there's always a focus on, how are we going to use this knowledge to bring it back to the community, to use it for the benefit of the people, to create something new that wasn't there before. So includes an assumption that the researchers are prepared to use that knowledge for practical applications. And there's an expectation to honor what is shared. There's a cyclical relationship towards research and developing knowledge that remains foundation to creating these solutions, and solutions that are rooted from the community itself. That are only merely aided by external researchers. The experiences that are shared are never my experiences. But I just do my best to capture what was said, bring it back to the research, ask if it's correct, and then use it to create something new with the people around me. So at its core, indigenous methodology hold a fundamental approach that knowledge is relational and serves a greater purpose for those who are implicated outside the research process. It's not simply confined to the research collaborators, but it is a relationship with all creation. So what does it mean? What does all of this mean for my research project? And so for my thesis project on indigenous masculinity, HIV wellness, and HIV disclosure, the uptake of indigenous methodologies and indigenous ways of knowing were instrumental towards ensuring that the research was conducted and will be delivered in a respectful and meaningful way. That indigenous methodologies were woven into the development of the interview questions and ensuring that the interview participants had the opportunity to discuss their personal values and culture and how to describe the research topic in their own words. And later on, with the completion of my research, with my thesis topic in January, I looked towards how to deliver this information back to the greater indigenous community through presentations, creation services, and we'll discuss that a little bit at the end of this presentation. So moving towards methods, quick part of this presentation. Participants were recruited through the community partner for this project, Canadian Aboriginal AIDS Network. So in total, 6 interviews were conducted due to the fast-paced nature of the MSW at McMaster. It wasn't a significant amount of time. The interviews were rich, to say the least. Participants were invited to participate if they self-identified as a male, identified as indigenous, older than 18 years of age, of any sexual orientation, and diagnosed and living with HIV. And so based on the previous warning that I had read in the literature surrounding indigenous methodologies, there was a caution to researchers conducting research with indigenous participants to remain aware of how, of possibly using Western terms in the research questions, as it might create responses that are in alignment with Western culture, right? To tunnel the responses straight to Western discourse, rather than traditional knowledge. So the questions underwent several revisions to be as open as possible and to eliminate as much ambiguous meaning, and to definitely allow to try and facilitate for open discussion on how the participants came to understand the world. So the questions were, what part of your understanding of masculinity is based on indigenous teachings and culture? Did your perspective of indigenous masculinity change after you were diagnosed with HIV? Process of sharing your HIV status with those who are close to you? Did the process of sharing your HIV come to affect how you perceive yourself and your masculinity? And do you think indigenous masculinity, HIV wellness, and disclosure needs to be explored in future research? So those were the research questions that I brought into each interview. For data analysis, another quick section on how I generate my themes for my findings. So under the direction of my thesis supervisor, the data was organized using a 3-step coding process to explore identifying identifiable themes. And the first step was to just simply group the first step was to group the transcriptions into smaller groups of quotes and stories that express similar properties and assign them with a code or thematic name. And these early codes included disclosure, stigmatization, familial responses, perceptions of HIV, perceptions of masculinity, and definitions of masculinity. In the second stage, axial coding, the codes are grouped together to explore meanings across different categories. The second stage, I mapped the codes based on similar meanings. So some of these included living in balance, living authentically. And they're grouped under the broader category of participants' understanding of indigenous masculinity. And in the final stage, which is thematic coding or selective coding, the individual codes were organized into identifiable themes to highlight the content. And here, the 4 main codes, main categories were established, and its subcategories were developed in accordance. And the next section, which is the results, we're going to dive into these 4 themes of what there is to say about indigenous masculinity, HIV wellness, and disclosure. Okay, so the interviews began with a general discussion of their understanding of indigenous masculinity and defining what it means to be what indigenous masculinity is. The first notable aspect of indigenous masculinity that was expressed in some way by every participant was the emphasis on being a provider and caring for those around them. So as part of indigenous masculinity, there's a collective responsibility to take care of one another. And this was often associated with the physical act of gathering resources and holding positions that facilitate the ability to provide for others. And these specific examples highlighted by the participant, including hunting and tracking. These were specific to those who lived in more rural communities. So a connection and a strong connection to the land was very integral to what it means to be an indigenous male. But beyond physical capabilities, the act of provision also included indigenous teachings and practices. So providing for others could also include emotional, spiritual, and educational support. And this was especially relevant to those who experienced a loss of physical strength because of their HIV status. And we're going to revisit this idea of providing in non-physical manners later on in the results in a different section. So some of the participants took an active role in teaching younger generations of their family. Others became a role model for their community in speaking at large conferences and leading HIV educational initiatives in their own reserves. The next aspect of indigenous masculinity was living authentically. And so living authentically encompassed a holistic view of identity where individuals can be authentic with their sexual identity, their gender identity, and their health status. Yet many of them found that the interference of colonization stigma has made it difficult for men to present an authentic representation of themselves. This is supported by the literature, which highlights how colonization has found its way within indigenous gender and sexual ideologies by promoting, as mentioned before, normative heterosexual and masculine identities. And so for the participants, they expressed challenges of needing to personally unlearn the Western perceptions of masculinity that they themselves grew up with as well, and to make way for indigenous masculinity, which aligned more with their traditional indigenous identity. And so, and the final aspect of indigenous masculinity that we'll be discussing in this project was the idea of living in balance, which was touched upon a little bit in the previous theme, living authentically. So living authentic in balance was described by the participants to be the internal foundation before indigenous men can confidently disclose their health status. Informed heavily by the teachings of elders in the medicine wheel, the participants described that healthy indigenous masculinity encompassed emotional, physical, mental, and spiritual well-being. And this was in stark contrast to Western masculinity, which promotes the idea that men should be stoic, reckless, individualistic, and carefree. But being in balance and being rooted in it, which is different than being in balance and rooted in indigenous worldviews. And indigenous worldviews, it teaches that men should be able to express emotion, to show vulnerability, to be empathetic. That being in balance is not only an aspect of indigenous masculinity, but fundamental to the individual to reach a point where they're healthy enough to understand how their indigenous identity is practiced through masculinity. Right. So after the discussion of what indigenous masculinity is, the second core theme is the changing focus of masculinity from physical abilities to mental dialogue. So now that HIV has entered the picture and entered the lives of the participants, some began a new journey. Oh, sorry. Participants described how HIV had a drastic change on the individual's perception of sex and sexuality. So now that HIV has entered their lives, some of the participants began a new journey that was rooted in health and wellness to ensure that their sickness does not worsen. And so they abandoned what would be described as risk-taking behaviors and self-destructive behaviors, and adopted a new lifestyle that was rooted in health. And here it's possible to examine the connection between HIV and indigenous masculinity, because for some of the men, HIV became a turning point for the men to live in balance and move away from these hypersexual behaviors and begin to explore what it meant to be a male that was rooted in traditional indigenous teachings. And this, after the contraction of HIV, the men emphasized that the illness helped them reimagine life, to see the fragility in health. And a few mentioned that in seeing how the disease and the lifestyle could have led them to death, it eventually led them down the road towards advocacy to support peers who had already been diagnosed with HIV. And so another shift that the men experienced was that given that the diagnosis of HIV resulted in a loss of physical ability, a decrease in overall stamina, they had to reimagine their masculinity. That indigenous masculinity was tied to their ability to provide and hold a job. So the decrease of energy that severs that connection forces them to reimagine, how do I continue to live as an authentic indigenous male while still able to provide for those around me. So for some participants, the disclosure of HIV status helped repair that disconnection by allowing men to provide experiential knowledge beyond the standard, beyond the traditional ways. Okay, I'm gonna skip some of these because I'm running a long time. So
yeah, you've got pretty much 1 minute to go.
Okay, so quickly, some other themes that we discovered along the way of in the research was, disclosure really helped in the pathway of healing. It created a new perspective towards HIV, where HIV helped them connect deeper with their indigenous culture and their indigeneity. it helped them find community, to find a safe, a supportive group for them to disclose and practice what it meant to be a healthy Indigenous male. And lastly, we can see how important disclosure was in the pathway of healing at the beginning and near at the end, or roughly saying at the beginning and the end, because disclosure marked the beginning of the healing journey, as it connected them with the support systems that they need, with the elders that they needed, and it also helped at the end when they began developing authentic connections with those who are also walking on this pathway of healing, and also to disclose their HIV status to the benefit of others. So what does this mean for future research? So we're looking to, in connection with another research project, project that focused generally on Indigenous masculinity, we're looking towards developing future research and new services to support Indigenous men. And this project also inspired an idea for me as I'm pursuing my PhD in September, to explore Indigenous fatherhood, to explore the connection between masculinity and fatherhood, and how lessons of traditional teachings are passed on to the next generation. And that is my thesis project on Indigenous masculinity, HIV wellness, and disclosure. Thank you.
Oh, thank you very much, Aaron. That was a very interesting presentation. And it's interesting coming from an ally, and how you went through processes of learning and unlearning, questioning ethics. And I would go further and say, being an ally, a lot of people call themselves allies to Indigenous, but they're just talking, and you're going further. I would call you a co-conspirator. You're making plans with Indigenous and implementing them. So I really appreciate that, and I thank you. I want to also remind people about the polls. So there are 3 questions there in the polls. If you would, when you get a chance, take a little time to answer those. And let's move right into our next presentation. It's called Exploring the Health Experiences of Indigenous, Trans, Two-Spirit, and Gender Diverse Communities, a Scoping Review. So I'd like to introduce to you Randy Jackson and Carol Lopez Ricote from McMaster University in Canada. Take it away, folks.
Okay. Hello, everyone. I'm just going to share my screen and hope for the best. Okay, let me see. Actually, sorry, one moment. Share screen. We want screen 2. Sorry. Oh. Can everyone see my slides?
Yes, it looks good.
Perfect. Alrighty. So thank you for that introduction, Trevor. As you said, we will be presenting on our preliminary findings for our scoping review that explored the health experiences of Indigenous, Trans, Two-Spirit, and gender diverse communities. So my name is Carol Lopez Ricote. I'm currently doing my Master's Social Work at McMaster University out of Hamilton, Ontario, and I'm the research assistant for the Indigenous Leadership Group who ran this project. And Randy, I'll let you introduce yourself.
I'm Randy Jackson. It's really lovely to meet with everybody today. I identify as Anishinaabe from Kettle and Stony Point First Nations in southwestern Ontario here in Canada. And I'm an assistant professor in the School of Social Work with a cross-appointment in Health and Aging in the Faculty of Social Sciences at McMaster University. And I have the pleasure of working with Carol and also Aaron. So anyways. Thanks, Carol.
Okay, so today our discussion points, we'll be discussing what Transpulse Canada is, what that project entailed, the rationale and objectives of a scoping review, the methods, and mostly our preliminary findings, and then we will have a discussion and implication section for a future study, and we'll have a few, I think, hopefully 10 minutes for a question and answer period. I talk a lot. I'm Spanish. I'm an immigrant here from Venezuela, so I will try to talk slowly for interpreters and also go pretty fast. Okay, so Transpulse Canada. So Transpulse Canada is a national survey of the health and well-being of trans and non-binary people in Canada that used a community-based research approach. So the Transpulse Canada team has an Indigenous leadership group within it that is comprised of Indigenous co-investigators who are academic or community researchers, including Renee Mashing from the Canadian Indigenous AIDS Network, who's watching us, hey Renee, as well as a larger group of research team members, Indigenous gender diverse persons, and an elder. So this national survey had a focus on 9 priority population consultation teams with survey questions added to examine inequalities of these groups, as well as addressing issues that are specific to each group. These questions were identified or developed by priority population consultation teams. So we also call them PPCTs, which were structured differently depending on the needs of each population. So the Indigenous Leadership Group was one of those PPCTs that helped develop the survey and also is now currently working to develop a follow-up study that will be using Indigenous and decolonizing methodologies. The developmental phase of that future study is nested within the current Transpulse Canada project. So the whole point of this presentation is to report on our findings of our scoping review, which are also going to inform the research grants for this project. We'll get into that a little bit further in this presentation. So our scoping review. The literature on the health of trans, two-spirit, and gender-diverse Indigenous people is very scarce. For this reason, this scoping review addressed the range and nature of existing research on the health and experiences with health services of Indigenous, gender-diverse, trans, and two-spirit people to systematically map research completed in this topic and to identify gaps in the knowledge and research implications. So the scoping review methodology, originally introduced by Arksy and O'Malley in 2005, was employed as it is considered an effective literature synthesis approach when a field is emerging and the depth of evidence is relatively unknown. Now, we had 3 overall objectives of this review. The first was to systematically map the research in this field and to identify existing knowledge gaps. The second was to expand knowledge in this field and identify future research recommendations. And lastly, as I mentioned, to inform a research grant to develop a qualitative follow-up study to the national survey that will have a decolonizing, community-based, strengths-based, and Indigenous ways of knowing focus to focus on the experience of wellness and health for Indigenous gender-diverse populations in Canada. So given this, the following research question was generated. What is known from the literature about the health-related experiences of Indigenous, trans, non-binary, and two-spirit people? Now, our methods. So using a community-based research approach and a scoping review methodology, existing knowledge in the literature was collaboratively and systematically searched using social sciences and health science academic online databases. So to locate the literature, the following databases were searched: Science, CINAHL, Medline, Embase, PsycInfo, ProQuest, EBSCOhost, and we also looked into the iPortal Indigenous Studies Portal research tool. The search was limited to scholarly peer-reviewed journal articles and book chapters written in English from 2005 to July 2019. The search strategy was developed and executed by the research assistant, which would be me, under the guidance of a librarian with experience in Indigenous health research in the Health Sciences Library at McMaster University. The final search results were exported using EndNote, a reference management software, and duplicates were removed by the research assistant during using the software. And the online database search was supplemented by searching through the reference list and by a literature review prepared by Sharp, and I believe Renee, that was provided to us. Okay, so in order to select the literature to screen it, we used Google Sheets and we created a kind of a screen charting process. And the inclusion-exclusion criteria that needed to be met in order for an article to be included in our scoping review were 3 things. The first one is that the article included a focus on Indigenous people and a discussion on gender identity. And lastly, that it discussed health, well-being, or healthcare in general. So in order for an article to be included, it had to include all 3 of those discussion points. And I would also like to mention that we had 10 reviewers who all received training on the screening software in the process, who worked in pairs on duplicate screening and evaluated the titles, abstracts, and full text of all publications. And whenever there was a disagreement on a selection of a source, there was a 3rd reviewer who also took a look at that, who also screened the article. Now, moving on to when we actually got the articles at the end, we did a thematic participatory data analysis. And the research team engaged in this analysis informed by the Flicker and Nixon's DEPICT model from 2014, which is a 6-step collaborative qualitative data analysis framework created for researchers with varying skill sets that places an emphasis on participation, collaboration, and transparency, all things that really guided and have been guiding our work together with the Indigenous Leadership Group. And the first stage involved dynamic reading, which involves each member of the research team reading a subset of the data and begin to think about themes and link ideas. For the purpose of our review, this was when all of the reviewers read through all of the literature in the screening process. The second stage is engaged codebook development, and that involves development of a list of themes that will be used to organize and categorize the data. So again, for this review, we used NVivo to analyze the data, but the research team came together and developed a code book. In the third stage, which is participatory coding, the developed code book is circulated and each member is responsible for coding a subset of data. Since there was a very high number of included articles for our review, 3 research assistants were hired to independently chart the data from the literature, and these reviewers discussed the results and continuously updated themes in an iterative process. And that was based on the codebook that was developed by the team. In the fourth stage, which is inclusive reviewing and summarizing of the categories, data preliminary coded for the project is reviewed and analyzed for different viewpoints in creating summaries. So in this stage, we used Google Sheets once again, and each person of our research team was assigned a code where they independently read through the code and the literature extracted in it, and they pointed out important information and kind of made sense of a story of what the literature was telling us. In the fifth stage, which is the stage that we're currently in, is collaborative analyzing. So now we're analyzing the summaries and the quotes picked from each code, and we're having discussions about what the data says and what the story we want to tell and what that will mean for the scoping review. So in July, we met approximately 3 times already, having discussions and making sense of this data. And the last stage, which is translating, is creating a dissemination plan. So for instance, for this presentation, the team gave us feedback on the presentation and on the themes. Now, our preliminary findings. So this is just a chart that shows the review process that I just talked about. So originally we had started with 3,641 articles. After the duplicates were removed, we had 1,107. Then we screened the abstracts and ended up with 137. And then once a full article was reviewed, we ended up with 47 articles. So now these are the findings. The first finding of our review is talking about the health experiences of trans, gender diverse, and two-spirit people. So within this theme, we're going to talk about their health experiences, factors, whether positive or negative or both, that influence health, and then responses to health experiences. Then we're also going to be discussing traditional knowledge systems and practices. So specifically, we're going to be talking about what is traditional medicines and food, what is their perceived value, what are the reasons for use, and how do those impact the health of gender diverse Indigenous peoples. Additionally, we're going to talk about the experience of combining traditional and alternative approaches to health. Moreover, we'll be discussing traditional practices and activities, so that can include the types of practices and activities that Indigenous, gender diverse, and also just all Indigenous peoples, though diverse, will participate in, the impacts of participation on health, challenges to participation, and then the community reactions. And then lastly, we will be talking about the connection between the land and health in the literature. So that includes discussion on traditional understandings of the land and the perceived health benefits of connection to the land, as well as position in relation to Western social determinants of health. Now, without further ado, talking about the health experiences. So our understanding of health is informed by the medicine wheel. So a healthy state is based on balance between 4 interconnected realms: the physical, mental, emotional, and spiritual. And these 4 realms cannot be understood separately. As such, the Western concepts of health can only be understood in relation to physical, mental, and intellectual, emotional, and spiritual well-being. With that being said, when it comes to physical health of Indigenous gender diverse communities, given the overall health statistics of Indigenous communities in Canada, the literature suggests that Indigenous people are at greater risk of developing serious health problems than the general population. Specific to the study is the health experiences of gender diverse Indigenous people. A major finding of this review is that two-spirits are thought to be at even greater risk of adverse health outcomes than other Indigenous populations. When it comes to mental health, as it is written about and conceptualized in the literature from mostly a Western perspective, Indigenous two-spirit people show adverse mental health outcomes compared to other groups. The literature mentions a sense of loss combined with isolation and inadequate social and professional support as factors that contribute to adverse mental health experiences of Indigenous two-spirit people. Moreover, the literature points to high rates of alcoholism, addictions, and attempted and completed suicides of LGBTQ+ Indigenous and two-spirit people. When it comes to emotional health, as I said, the way that the literature is conceptualized this topic, this realm, the literature suggests that there are higher rates of mental health disorders among Indigenous people compared to the general U.S. population. Depression was the most commonly reported lifetime disorder. And compared to their heterosexual counterparts, GLBT individuals have higher prevalence rates of anxiety and mood disorders. Lastly, in terms of spiritual health, a growing body of literature indicates that religiosity and spirituality are predictive of good health-related outcomes, including decreased levels of anxiety, depression, perceived stress, and alcohol intake, and then therefore an improved quality of life. Several important articles link spirituality as a protective factor in buffering against health risks in Indigenous communities. So speaking of factors that influence health, it is important to ground our understanding of health inequities in Indigenous gender diverse communities in the context of social determinants of health and the historical and intergenerational trauma from colonization. In the literature that we reviewed, colonization is actually viewed as a key determinant of health for Indigenous community. Moreover, the literature suggests that gender diverse and two-spirit people are particular targets of violence in Canada's history of colonization due to the challenge she posed to European Christian worldviews. This legacy of colonial violence is reinforced by ongoing structural violence and inequity, including inadequate housing, education, and food security, as well as frequent exposure to violence, all Western social determinants of health.
Yeah.
Sorry, Randy?
No, sorry, go on.
Yeah. So Indigenous gender diverse people encounter both institutional and interpersonal racism, homophobia, and transphobia that affects their health outcomes. For example, the literature discusses that both of their dual marginal status as both Indigenous and GLBT, two-spirit people often feel caught in and between both identities. This causes significant strain as two-spirit people struggle with multiple oppressions, both homophobic and transphobic, as well as colonial. And because of this, two-spirit people often experience rejection by both communities in which they reside or lies, in their Indigenous community and in their GLBT plus community. And then when it comes to factors that influence health from a positive and Indigenous perspective, health outcomes are moderated by cultural buffers, such as identity, enculturation, spirituality, and traditional health practices. From an Indigenous worldview, these cultural moderators are aspects of holistic existence that maintains good health. So for instance, McIver and Napoleon from 2009, an article with this author, proposed that 6 linked themes emerge as protective factors against health issues for two-spirit and gender diverse populations, which are land and health, traditional medicine, spirituality, traditional foods, traditional activities, and language, which we'll be discussing a bit further later on in the presentation. Moreover, Indigenous people generally define health more broadly than one's overall physical condition. Rather, health is seen as a holistic, encompassing all parts of oneself, including physical, mental, emotional, and spiritual wellness. When it comes to spirituality, Indigenous traditional worldviews recognize the interdependency among humans and nature, the physical and the spiritual worlds, the ancestor and future generations, and those are connections that bind all living beings in spiritual ways. Other factors that influence health that are very specific to two-spirit populations is a reclamation of traditional roles and identities by two-spirits. So two-spirit people confirm that achieving a positive self-identity is seminal to the development of self-esteem and, as a result, good health. And two-spirit people can look at a unique history in which two-spirit people were not simply tolerated but honored for their status. Claiming this identity can, therefore, help reposition two-spirit people as central to their community's history and tradition. So now that we've understood their health experiences and how the literature has found out about it, there's also the responses by health to these experiences. So individuals in the literature are said to either use or not use substances to cope. They have an improved relationship with themselves. They have familial support. They have a sense of community, and their connection to their culture and identity as two-spirit are all responses that promote good health. When it comes to the responses by health programs and services, good programs that support self-determination are really important. So services and supports have a central role to play in creating an atmosphere of safety in which two-spirit people can come out and self-affirm, thereby supporting good health. There's also a need for cultural programming, understanding of sexual and gender diversity, and accessible, affordable, non-judgmental support from counselors who are informed about trans and two-spirit issues, experiences, and identities. Now, when it comes to health policy, we need policy that decolonizes the environment in which we exist, that it supports self-determination, and policy needs to start with Indigenous teachings related to holistic health. Healthcare policy markers and providers know very little about two-spirit people and their healthcare needs. So this must be dealt with. The services have to be transformed to meet the needs of Indigenous, two-spirit, gender diverse, and trans populations. So that's our findings for the first theme. Now, when it comes to traditional knowledge systems and practices, the literature also focuses on traditional foods and medicines. So what we mean by that is that traditional food is medicine, that traditional food can be both plants and animals, that use traditional foods and medicine as a practice that is connected to the spiritual, that the actual act of acquiring traditional foods and medicine is a spiritual practice, that is connected to storytelling, and that it is connected to ceremony. So more about what the literature talks about. So the literature cites the indigenous concept of traditional food is medicine. So for example, they cite they cite the use of evergreen tree extracts and blueberry plant roots to control type 2 diabetes. Moreover, traditional diet and lifestyle patterns provide protection against Western diseases, as the rate of chronic degenerative diseases were historically very low in indigenous populations. So in indigenous cultures, there is no clear distinction between food and medicine, as food is medicine. Moreover, the literature talks about the connection of traditional food as both plants and animals. So traditional foods are both plant and animal harvested from the local environment. And there's a connection between the land, the plants, and the animals. So when it comes to the connection to the spiritual, plants are alive and have a spirit. So the literature talks about the spirit power that is what gives healing life to the herbs being utilized. This is why elders describe traditional healing as a process based largely on spiritual faith, is what the literature says. The literature, moreover, talks about the traditional medicine, discusses that it's about the person's belief in it as it is about the medicine itself. Another finding in this review is a strong link between traditional medicine and spirituality, and harvesting medicine is medicine. So it talks about the therapeutic and healing aspect involved of being spiritually connected to Mother Earth and what she provides for you. Lastly, there's a connection of traditional foods and medicines with ceremony. So there's a holistic healing properties associated with being out in the land, and there's also healing properties in partaking in preparations, ceremonies, and all aspects of the harvest. Now, when it comes to traditional medicines and food, the perceived value attached to it is that it contributes to curing and healing from illness. It is also indigenous medicines that makes a connection between land, language, and culture, and there's a spiritual connection, as I just talked about. And the reasons for using traditional medicines and food is to use to treat and cure illness. It offers protection against Western diseases and sees food as medicine. So now there is some literature on the experiences of combining traditional approaches to alternative approaches to health. So the first talks about how traditional medicine is used for treating the underlying cause, whereas Western medicine can be used to treat the symptoms. So there is a separation of the two, but they're also used together. There's also some tensions, as the literature talks about the experiences of two-spirit use using marijuana in sweat lodges. So it's a combination of two different approaches of health. And then there's a distinction made in the literature of curing versus healing, where curing is seen as a treatment of the illness, whereas healing is seen as a lifelong process. And now when it comes to the impacts of traditional medicine and food on health, the positive aspects and impacts of it cited in the literature is that traditional diets are viewed as healthier. They're also more economical. Traditional medicines and food are used to maintain culture, and they're maximized in the context of deep beliefs related to its efficacy. It also facilitates a connection to the land as key indigenous determinant of health. When it comes to the negative, the literature cites the shift to Western diet as negatively impacting health. So processed food is less healthy, and it has a connection to a loss of culture. So now, I'm sure you guys are sick of my voice, so I'll pass it on to Randy to talk about traditional practices and activity.
Thanks for doing all the heavy lifting, Carol.
I hope I didn't do too fast.
Yeah, so I'm going to try to wrap up in about the next 4 or 5 minutes because I want to give Trevor time to also wrap up the entire session. Cool. So the next thing we looked at in terms of supporting sort of this idea that Indigenous trans live well was this idea that it was connected to participating in cultural practices or activities. Now these, if you can just switch to the next slide, Carol, these practices and activities were considered, were diverse, right, in terms of the range of activities, and it was very much connected to, the types of activities were very much connected to your one's tribal identity. So it shifted based on that. They were largely considered, I mean, we can divide these activities in a number of ways, including It can be ceremonial, such as participating in talking circles or sharing circles, pipe ceremonies, etc. It could be some kind of subsistence activity. And just to build on Carol's earlier slide here, it's connected to things like hunting, fishing, trapping. It's connected to arts and crafts, so beading, painting, and also about physical activities such as sports, including lacrosse. So indigenous games, in other words. I think one of the really interesting studies we read or came across was this idea of drumming. Indigenous people drum, right? So this study explored how drumming actually realigns our internal body rhythms, right? So I think that was really an interesting thing. So participating is conceptualized as a right. It's our right to be participating in our culture in ways that support our identity and also cultural orientation. Next slide, Carol. In terms of its impact on participation, the literature almost exclusively identified this idea of shaping values, of participating as a healing journey, used to cope, used to cleanse the soul, an expression of gratitude, an expression of one's cultural identity. So these were the ideas that were most widely cited in the literature that we talked about. In other literature, talked about this connection to the spiritual world and particularly to one's ancestors. So it was this sense of connection with the world beyond us, an expression of, and we heard this in a number of different articles from a number of different sort of tribal identities, that it was about living the good life, which is Anishinaabe, walking in balance, which comes from the Cree language, and then also walking the red road was also a more generic way of expressing this idea of participation as something that's culturally congruent, that supports one's identity. Ceremony or participating in one's culture actually creates space, right? It creates space where we can feel like we're normal, and where if one knows or learns or is on that journey of learning and acquiring knowledge around practices, it's actually about increasing your social and cultural capital is accrued from having done that. It's knowledge that's valued in our communities. And it aligns with and supports, of course, the development of living a healthy Indigenous identity. Some of the challenges related to scientific studies that are addressing traditional activities and its impact on health is that it doesn't really lead well to scientific study, right? So in other words, the scientific rules that we have around proof and evidence are difficult to establish. And I'll just draw you back to that idea of the spirit world and our connections to elders. That's something that science really can't know the way, and I'm talking here about Western science and not Indigenous science. And how studies from the West have often marginalized Indigenous knowing and doing as a result. Next slide, Carol. Some of the community reactions to around ceremony. We heard this very clearly. Carol talked about our national survey. We started to hear this in that national survey as we're also doing preliminary analysis around that. But there's this idea that our communities are shifting their attitudes around Indigenous trans, and that more Indigenous trans, at least in Canada, are beginning to participate in their ceremonies or leading their ceremonies in their communities, right? And what this does is it confers a sense of acceptance and belongingness. It's been described in the literature as a form of collective resilience. It's about being inclusive of traditional pan-Indigenous and Christian approaches to living well. The recognition of traditional roles for Two-Spirit or even Indigenous trans. Also, the assigned ceremonial roles that Two-Spirit people hold, how it can align with harm reduction approaches It can be supported by cultural program. And we've heard this from, I think, all three studies now, is that it offers a protective factor. And again, traditional activity is considered a right. Next slide, please. The next thing that we were looking at was this idea of, and if you can just click on all the titles there so I can see them, please. Thank you. Yeah, was this idea of the connection between land and health. And this was considered, I think, central. And I can just click on the next slide, Carol. This idea of the connection between land and health was considered perhaps central to the idea of what keeps Indigenous people healthy, right? So it's been talked about in the literature as a way of critiquing the relationship that Indigenous people have with the West. So it's a way of critiquing colonialism and its impact on lesbian, gay, bisexual, transgendered, questioning, or two-spirit peoples. And this is the place that most studies began by doing this. And that we need to really be mindful of the need to focus on the strength of gender diverse populations in Indigenous communities, right? What we found was that gender diversity was really an under-researched area, right? Particularly specific to Indigenous, trans, or gender diverse populations. We do not know a whole lot about that. And that's basically our takeaway message from having done our literature review. The West tends to talk about progress and development of scientific knowledge as being something that is important to happen, right? We would like to reframe it as colonial expansion when the West talks about progress and development, because that's what often it means, right? In other words, the West talks about land as something that's a commodity. It's something that we can exploit. It's something that we can control, and that we do this in the name of profit, right? And this is really at odds with Indigenous ideas about the land as something that one's related to, and one's connected to. And so when we ignore sort of Indigenous ideas of the land, right, it has negative impacts on Indigenous health, including, again, the marginalization of traditional knowledge systems, the ways in which the West ideas around the land can also contribute to environmental racism, which leads to environmental degradation, which can curtail, reshape some of our traditional activities like hunting or fishing, right? And when that all happens, it potentially leads to some health and social crisis. Next slide, please. And I'm looking at the time and I'm trying to give it enough time for Trevor here. So the next slide, please. Oh, yeah. Okay. So the traditional understanding of land was that it was a feminine spirit, i.e. Mother Earth, nurturing. And that's not to say that men can't be nurturing, but again, that's a value that's often labeled with the feminine spirit. And that's how it's been talked about in the literature. This idea of being of the land was considered extremely important across, I think, most of the literature we read. It was described as something like reciprocal balance. I'm in balance with my land. I feel connected to the land I'm on. Everything is alive, everything is relational, and everything gets access through ceremony. And what this idea does is extends our usual biomedical parameters for psychological well-being. In other words, even though social determinants of health are extremely important in terms of housing, income, employment, etc., right? When we think about the land, when we think about the food that we consume, when we think about the traditional activities that we're involved in, these really extend and start describing a different set of social determinants of health that are very much Indigenous grounded, right? So there are a range of things beyond the social determinants that also keep us healthy that we must attend to when we're doing research. So the notions of, again, being alive well, or living the good life, or being part of the web, or feeling deeply connected are things that people experience when they develop that connection. Next slide, please. Okay, so some of the benefits of this connection to the land, and I've been touching on this as I've been going through, as was Carol, as was Aaron, and our earlier presenters with the film, right? And really, the point that we want to make here is that cultural gender diversity identity matters in research, right? So I've talked about the fact that there really are no studies that focus on Indigenous trans, for example, that we were able to locate, and that's something that we want to correct, and I'm going to talk about that in a bit, right? And this idea that the land is alive, it's a direct link to health, to well-being, and you foster that relationship to the land as part of one's healing journey, which Carol described as this lifelong process. It also confers a sense of agency and choice or self-determination. Like, I make the decision to do these kinds of things, and that helps me feel better. It supports a sense of this idea that I'm not alone, right? Because if I have a strong connection with my ancestors who are in the spirit world, right, I know that they're always there when they need me, right? It also reduces stress and improves a sense of resiliency and strong mind or balance. And we just want to trouble too a little bit about this idea of resiliency and strong mind. Resiliency is talked about in the literature as you encountered some sort of negative situation and you rebound from it, right? Whereas a strong mind, which is more culturally grounded, these are gifts that we were born with. These are gifts from the Creator, right? So there's a big difference between how the West conceptualizes resiliency and how Indigenous people tend to talk about resiliency in different ways, such as the strong mind. Next slide, please. Okay, so we learned, I'm just going to wrap up here, Trevor, very quickly in about the next 2 minutes, I hope. So we've learned that from the literature that there's really no clear definition of transgendered identity from an Indigenous lens. Our work with our Indigenous trans community here in Canada supports that idea. So we adopted the words gender diversity, but we still struggle with that. We still struggle with that because we want to talk about sort of the transition of genders from male to female or female to male as being something that we want to focus on. So, but many Indigenous trans that we work with here in Canada do not like to adopt that definition. So we struggle with that a bit, and we didn't find any sort of direction in the literature on it. Again, studies that are grounded in the West, that are looking at studying sort of culture and Indigenous culture, again, it doesn't lend itself to scientific study. For example, the proof or evidence rules in Western tradition really don't align with Indigenous knowledge very well in some respects, right? Indigenous knowledge continues to be at the margins of Western thought, although that's changing. And most of the literature is deficit-based and framed around this idea of fill in the blank. And there's a lack of research on the link between land and health. Next slide. So Carol talked about, just the next slide, Carol. Carol talked about this future research project, and this is sort of where we're landing on it now, right? So we had a community consultation session in Vancouver back in October or November, I think it was, and we asked our community partners, people who identify as Indigenous trans, what they would like a future study focused on. And what they told us overwhelmingly was what does wellness look like for Indigenous trans or gender diverse peoples, right? And we conceptualize gender diversity as people who identify as trans, two-spirit, or non-binary. We're going to use, as Carol talked about earlier, a variety of different methodological approaches, including community-based research, right? We want to shape our community-based research using Indigenous and decolonizing approaches, because the West still offers some value in terms of scientific approaches. We're adopting this idea of two-eyed seeing, which is really about holding the strength of Western ways of knowing alongside and in balance with the strengths of Indigenous ways of knowing, and trying to foreground that at the get-go. And then again, being strength-based, right? It's important, if we were only to talk about sort of challenges that Indigenous trans face, right? We fear that we contribute to that pathologizing, Indigenous trans, and we really don't want to do that. So we want to be strength-based in our approach and talk about the strength of Indigenous trans in the context of some of the challenges that they faced, right? So we're taking a different kind of approach, I think, with this study. We're looking at, and again, some of our scoping review talked about this, the difference between Indigenous trans either being urban-based, which is largely the case, but again, there are some Indigenous trans who live rurally, and it's those experiences that are not very well known. Our priority group, our leadership priority group, identified body mapping as a potential data collection tool, and body mapping really is about creating your body on a piece of paper that you on the floor, and you're drawing or painting or collaging or whatever the case may be. Your ideas around who you are as an individual, who your gender identity is. So that's what we're going to look at. And then we're going to unpack the body maps using in-depth interviews. We're going to use, it's going to be a very participatory research. So Carol talked about how we use the DEPICT model as part of what we did in terms of analyzing the scoping review. We're going to continue with that. And we're going to do narrative and visual analysis. Next slide, Carol. And I think that's it. Questions or answers. And I'm going to turn it back over to Trevor to lead us through to the end here. Thanks, everybody, for listening.
Well, thank you very much for that, Randy. This session has been called the Evidence-Based Responses for Diverse Indigenous Key Populations. So thank you to everybody. You know, during the international AIDS conferences and our Indigenous pre-conferences, we try to have a strong focus on that particular region, right? So in this case, it's North America or the Americas, but we also acknowledge the estimated 476 million Indigenous peoples living in approximately 90 countries around the world, representing 5,000 different Indigenous cultures. And because we originally planned to meet in person in the California Bay Area in the USA, we want to especially acknowledge the unceded land of the Ramaytush Ohlone in Yelamu, known as San Francisco, and the confederated villages of the Lisjan Ohlone peoples in Huichin, and that's Oakland, California, and neighbored by the Muwekma Ohlone, the Costanoan Esselen, and the Rumsen and Mutsun Ohlone. So thank you to all of our presenters. I'm your moderator, Trevor Stratton, the coordinator of IGWA, the International Indigenous Working Group on HIV and AIDS. I want to also thank the interpreters and the technicians and everybody who came together to make this possible. Have a great day, and don't forget to join us for our 9th WISER webinar this Saturday, July 25th, titled Diverse Indigenous Responses to HIV, India and Canada. Have a great day. Take care. Bye-bye.